Hi, I'm Pat Becker, the Chief Strategy Officer at Mazik Global in the Healthcare Division. I'm here today with Haroon Ansari, who's the CEO and President of Pinnacle Hospital in Indiana. Haroon, tell us a little bit about Pinnacle.
Sure. Pinnacle Hospital is a surgical facility located 25 miles outside of Chicago. It has about 250 physicians credentialed in the facility. We have 5 operating rooms. We do about 250 to 300 surgeries per month. We're a multi-specialty surgical hospital, and also we provide radiological services and tremendous amount of acute care services for the community. We're happy to be here with you to discuss Mazik Global's initiatives using Microsoft platform. So,
great. So when you're implementing the Microsoft Dynamics AX solution and the Microsoft CRM solution, as well as Mazik Care, what kind of value do you think that'll bring to your organization?
I think it will help us tremendously in terms of cost allocation, cost savings, resource management, looking at quality outcomes. But most important part is that right now we're using 6 or 7 different data tools to be able to make decisions, and nothing is integrated. Healthcare is a very complex system, primarily due to regulatory requirements and also due to a lot of contractual requirements you have at big players like Blue Cross Blue Shields of the world. So we're hoping that using solutions from Mazik Global, it will enable my team, the end users, providers, nurses, techs, purchasing department, billing, accounting, the whole system at the hospital level to come together to be able to make real-time decisions, to save money, to better provide in terms of outcome management, and at the same time to be able to allocate resources, as I mentioned before.
Great. I know as we're looking at the implementation, you've discussed how the use of mobile technology within the organization, both in the supply chain as well as on the nursing units. How do you think the mobility solutions will help with the reduction of cost and help to increase the quality of care you're providing your patients?
Oh, absolutely. I mean, healthcare has a lot of duplication in there, and if you don't have real-time information, it's very possible you may be repeating lab tests, you may be repeating MRIs, you may be repeating, in some cases, some surgeries and procedures. So I think having accurate data and real-time data on hand that literally it integrates all information that you may have from billing and the clinical aspect of patient care-related items. It will help us with purchasing. It will help us with allocating resources, I mentioned before, which is very important because in acute care settings, you need to constantly look at your nursing ratios. So depending on what kind of care you're providing, looking at it by diagnostic category, it is very important to be able to allocate resources accordingly. We aren't able to do that today. This is done manually, and this is a manual decision-making process. And that kind of stuff, in my personal opinion, does not necessarily benefit the patients all the time. So I think with having mobility on board, we'll be able to integrate those various aspects of healthcare delivery.
Well, great. Thank you, Dr. Ansari, for your time today.
Thank you.